Recording in progress.
Hello everyone, thank you for joining our session. So we will just wait for like 5 minutes as our moderator is facing some technical issues, and we will start. Thank you again.
راشد لا نزل.
ايوه
Hello, Karima. في حاجة أعراض كمام. بس واحد ما عنده.
Hello, Karima. This
Yes.
is Ralph. I'm calling in from my phone.
Hello. Okay, we were waiting for you, so we can start now.
So I lost the connection entirely,
Yes.
and I can't get back in on the Zoom meeting, either through my phone or my computer. So I'm not sure what's going on. So I can't see any slides, so you may have to tell me what slide is up.
Okay, we still didn't start, so we are in the introduction slide.
Okay.
Okay, thank you. Okay, Mervi, you can start.
Okay. Hello, everyone. We welcome you to our discussion session. We know that you will have a good time with us in this morning, afternoon, evening, depending on where you're joining us. Please let us know your name and which country you are joining from by typing into the chat box. I also would like to welcome our speakers and our moderator. I'm Merve Yıldırım, fourth-year pharmacy student from Turkey and IPSF Pharmacy Education Committee member. Please make sure that you are muted during the session, and please ask your questions into chat box. Our speaker will answer them at the end of the session. And finally, if you have any feedback for us, please fill the feedback form that will be shared at the end of the session. I would like to let you know that this session is being recorded and live streamed on Facebook. Before we start, I would like to give a brief introduction on FIP Development Goals. The FIP Development Goals were launched in 2020 to set the direction for global pharmacy development and transformation by 2030. They provide a comprehensive direction to support needs-based development and transformation of our whole profession nationally, regionally, and globally. The 21 FIP development goals aim to ensure alignment of pharmacy workforce, education, practice, and science with global health and development needs. As IPSF Pharmacy Education Committee, we decided to organize this session on five of these development goals. Development Goal 1, Academic Capacity. Development Goal 2, Early Career Training Strategy. Development Goal 6, Leadership Development. Development Goal 8, Working with Others. And Development Goal 20, Digital Health. We are having this discussion session to discuss how FIP development goals aim to increase to integration of pharmaceutical sciences, practice, and education globally, to focus the selected 5 FIP development goals and what FIP aims to achieve through this goals, to highlight how pharmacy students and young pharmacists, pharmaceutical scientists can partner with FIP to affect the outcomes of the FIP development goals, and to discuss how to increase the applicability of the FIP development goals. Today, this session will be facilitated by myself and
Hello everyone. Good morning, good afternoon, good evening from wherever you join in our session. For today's discussion session, we'll be having speakers from the FIP, from the FIP-YPG, that's the Young Pharmacists Group, and the IPSF. So from the International Pharmaceutical Federation, we have Mr. Shepard. Mr. Shepard is a practicing community pharmacist and master's candidate in health economics. Is the chairperson of the Young Pharmacists Group Africa, and he currently serves as FIP Global Lead for Early Career Training Strategy. Our second speaker from the FIP is Professor Patricia. She's a professor of pharmacy from the Faculty of Pharmacy, School of Chemistry and Pharmacy, University of Valparaiso, Chile. She is the Commissioner Advisory Committee of the Ministry of Health on behalf of the Chilean Faculty of Pharmacy, President of the National Autonomous Corporation for Certification of Pharmaceutical Specialists, and also Associate Editor for the Pharmacy Education Journal of the FIP. Our third speaker from the FIP is Mr. Minesh. He is an independent prescribing pharmacist and runs long-term condition clinics on asthma and structured medication reviews in a general practitioner's practice. Our last speaker from the FIP is Professor Lillian. Professor Lillian is a professor of pharmacy and head of the Department of Pharmacy and chairperson of the Doctoral Committee of the Faculty of Medicine and Surgery at the University of Malta. She's a member of the advisory group of the academic institutional membership within FIP and serves as president of the European Association of Faculty of Pharmacists. So from the FIP Young Pharmacists Group, we have Mr. Suleiman Sule from Nigeria, we have Mr. Demetrios from Greece, and from the IPSF, we have Mr. Mayat from the Asian Pacific Regional Office, Mr. Braham Wagner from the European region, Ms. Hilda Al-Qadri from the Eastern Mediterranean region, Mr. Noah Sisi from the African region, and Ms. Maria Fernanda from the Pan-American region. So I'm going to hand over the session to our moderator, Mr. Ralph. Ralph, you can have the floor. Okay.
Hello, Professor Ralph, can you hear us? Okay, just a second.
I think Ralph has been muted, so
Yes.
maybe someone should unmute him.
Hello, can you
Hello.
hear? Yeah, yes.
Sorry about that. I lost my connection. It looks like it's an Outlook server problem because it's not connecting to my email or anything else at this point. So I apologize for that. So I'm joining you by phone. But at any rate, we'll move on. So hello to everyone, and thank you for joining us today for this program. I am Ralph Altieri. I'm the Dean of the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences in the United States, and I'm also the chairperson of FIP Education. I'm going to say a few words about, you've gotten the introduction to the overall program and the development goals, and we'll be reviewing each one of those as we go along. So I thought I'd say a few words to familiarize you with FIP education. It is one of the three major organizational structures within FIP, the other two being the boards of pharmaceutical practice and pharmaceutical sciences. The vision for FIP education is to stimulate transformational change in pharmaceutical education and training as the foundation to advance both pharmacy practice and pharmaceutical sciences. And our mission is to bring together organizations, leaders, and academicians who are working to improve health through advancing both pharmacy and pharmaceutical sciences education. So to fulfill that mission and vision, FIP education brings together the various units within FIP that have a focus on education and career development. So those would include the academic pharmacy section, and we have somebody from that section today on our program. And this section focuses on faculty curriculum and assessment development, the academic institutional membership, where schools of pharmacy as an institution belong to FIP, and that focuses then on the leadership of those programs, and its programming is targeted at leadership development and enhancement. There's the Workforce Development Hub, which is a fairly descriptive title, and it focuses on the development goals and has working groups for each of those development goals to help market and implement those development goals. There's the FIP UNESCO UniTwin program, and UniTwin stands for University Twinning, or partnerships between universities and pharmacy schools to share best practices in education and to learn from each other. Then we have representatives also from the two boards of pharmacy practice and pharmaceutical sciences. And of course, we also have representatives from both FIP-YPG and IPSF. So we have this wide representation across all of FIP, as we all understand that education and training underpins and supports the other activities in practice and science. And today we'll hear from some speakers who come from the Workforce Development Hub, who are joining us to comment on these 5 development goals. So it really is my pleasure to serve as the moderator of this session. I have served as the academic section liaison to IPSF for a number of years, and I've attended a number of their annual meetings, doing interactive workshops and speaking with students and recent graduates. Always learning something new, always gaining insights into your perspectives and your career goals, which is really important for all of our futures and certainly for that of the profession. So I just want to thank IPSF and YPG for organizing this program to increase awareness of the FIP development goals that act as a roadmap for FIP and all of its constituents to move ahead in the years ahead, and importantly, for the continuing evolution of the profession, which is critically important, of course, for your careers. So I look forward to discussion, and to all of those on the Zoom meeting, your participation in the question and answer session, where we have reserved time later in the program for your questions and comments. So we'll move on to goal number 1, and for each of these goals, the FIP invited speaker will give a brief overview of that development goal, and then I'll ask questions related to that goal, first to the speakers from IPSF, then YPG, and then to the FIP speaker. So we'll start with goal number 1, the academic capacity, and for that we have our representative from FIP, Patricia Acuna Johnson from Chile. And if she might say a few words about herself, I know there's been some introduction already, and then give us the overview of the academic capacity development goal 1. Patricia, the floor is yours.
Yes.
Thank you. Yes, thank you, Rob. And thank you to IPSF and YPG for inviting us to this event, which is very important, as Ralph already mentioned it. Well, I am part of the group, the leads of the development goal number 1, academic capacity. As you may read on the slide, this academic capacity, this development goal is involved in engagement with pharmaceutical higher education development policies, and it is ready to access to leaders in all sectors of pharmacy practice and pharmaceutical sciences in order to support supply side workforce development agenda. As all development goals that have been developed by FIP, there are different mechanisms that I'm not going to read them all, but to carry out all the initiatives that will be able to allow to get some outcomes out of them. So in terms of the mechanism, increase the capacity to provide competitive pharmaceutical workforce, develop new and innovative ways to attract young pharmacists into all areas of pharmaceutical practice and science, especially in those areas that are needed in each of the countries. Capacity building and enhance interdisciplinary and interprofessional education and collaboration. And finally, knowing that the clinical academic educator workforce needs more attention to get better outcomes with our students, we realize that they need more attention on training, career development, and capacity building. Using data and evidence intelligence, in other words, to support investment in pharmaceutical higher education. The last thing I would like to say about developing goal number 1 is that this is very related to early education and training. So academic capacity links to early career and quality assurance of the programs. The leads of this group is Dr. Claire Anderson from the University of Nottingham, Dr. Sean Gleason from the University of Colorado, and myself. Next, please.
Okay. Thank you, Patricia, for that overview and introduction. We'll move on to the questions we have. First, for IPSF and FIP-YPG. So if our two representatives could introduce themselves very briefly, and then we'll move on to the questions.
Hello, good morning, good afternoon, and good evening to everyone from wherever you're joining us. Thank you so much for joining us for this session. And I would like to thank our speakers from FIP and FIP-YPG who are here to discuss the important thing about academic capacity together. So I'd like to introduce myself. My name is Metujo. You can call me TK, and I'm actually the Regional Projects Officer from the IPSF Asia Pacific Regional Office. So I'm a recent graduate from the National University of Singapore, and I'm currently serving as the RPO in IPSF, running public health, professional development, and pharmacy education programs that are relevant for our member organizations under the Asia Pacific Regional Office. So I look forward to having a meaningful discussion with you guys. Thank you.
Thank you.
So hello to everyone from my side. Thank you IPSF and FIP for organizing this great event. I am Dimitris Ilias Balourdas, and I come from Greece. I'm a full-time PhD candidate since August 2020 at the University of Frankfurt, Germany. And I am a research member of the Structural Genomics Consortium in Frankfurt. I obtained my pharmacy diploma in 2019 from the University of Athens in Greece and completed my pharmacy master's degree in the University of Frankfurt within the framework of the Erasmus program. I am also an active member of the FIP-YPG since early 2020, initially as a member of the group that created the Career Development Toolkit, and currently as the Academic Pharmacy Section Liaison. Thank you. I'm looking forward to a great event.
Thank you, and thank you both for joining us. So the question we have for you is, what guidance and support do you need from FIP to empower pharmacy students and recent graduates' academic capacity?
Thank you, Professor Ralph, for the question. So pharmacy education can be considered a cornerstone of any future pharmacist, as it imparts the essential knowledge, skill set, mindset, and attitudes that are required as a pharmacist, truly independent, medical professional, or a valued pharmaceutical scientist. In Asia Pacific, there is a huge diversity in pharmacy educational standards across the region. With the current COVID-19 pandemic, having a sustainable education becomes an added challenge for many of our pharmacy students across Asia Pacific. These unprecedented challenges add to the existing backdrop of challenges in the pharmaceutical education system and presents us with opportunities to innovate the way pharmacists are trained across Asia Pacific. The very first thing and very first step that FIP can better support our students is to engage in discussion and fruitful conversation with the academic faculties, especially those from lower income countries. And during these discussions, the discussion work group would have to figure out ways and means of incorporating the unifying standards in pharmacy and pharmaceutical education, such as good pharmacy practice and evidence-based medicine. It is vital that during these discussions, the work group adopt a genuine, consultative, and people-centric approach. In this case, people referring to the local academic institutions, in order to produce long-term development goals or set clear targets for these faculties and chart specific actionable items. Though these academic faculties may not report directly to FIP, FIP should remain as a position of helpful and resourceful facilitator. Another way that FIP could assist the student in the context of COVID-19 pandemic is to affirm good practices of remote teaching, remote assessment methods, and feedback mechanisms that remain essential to the learning cascade of students. Both the faculties and students face enormous challenge in maintaining the same pharmaceutical education standard and delivering the same educational outcomes while doing it remotely. Pedagogical innovations from similar fields such as medical and nursing education should be considered for adoption with appropriate adaptations made that is suitable for pharmaceutical students and cultural adaptations that are suitable for local implementation. When resources accommodate, future research should be expanded on remote models of education in pharmaceutical and pharmacy education field. This way, good practices of remote educational methods may diffuse from one country to another, and together will be able to reap the benefits of being interconnected altogether. To end off, there are currently two gaps and opportunities for FIP and academic faculties to collaborate and expand on the academic capacity of our faculties in making good pharmacy education practice and evidence-based clinical practice a reality with specific, accountable, and actionable plan. This way, we advance equitable pharmacy education across Asia Pacific. The same affirmation applies to a good model of remote educational tools so that we may sustain good pharmacy education outcome and bridge the innate educational inequalities. All of these amidst the COVID-19 pandemic backdrop with the stark requirement for remote educational technologies. Together, we can make pharmacy education emerge stronger with innovation, learning, and persistence for higher academic capacity of our pharmacy students. Thank you.
Thank you, Ralph, for the question. So I think FIP represents pharmacists across the world and acts as a uniting force for all of us. So having a platform that advocates and promotes the interest of health workers and academic researchers in our profession is definitely one of the most important sources of empowerment today. And I hope that this continues to be in the future as well. Myself being interested in the educational aspect of the pharmaceutical workforce, I am involved in various mentoring projects as a mentor. So I think FIP could enable us, as the young pharmacy professionals, to educate and contribute more in this role by providing, for example, train-the-trainer workshops. I also believe that as young professionals, it is crucial that we remain vigilant on the latest updates that cutting-edge research, technology, and digitalization have to offer. And I think the best way to do this is by providing opportunities to pharmacy students and recent graduates to educate themselves and work on new innovations and trends in our science. Finally, FIP as an international platform, I believe it's our duty to push for equal access and opportunity to education and professional development by ensuring that every pharmacist worldwide can benefit from internships, workshops, readings, and trainings to prepare them for, in order to contribute in the most effective way possible in the advancement of pharmaceutical research and to diverse and high quality therapies.
Okay, thank you very much for that, Dimitrios. We'll move on to the questions for Patricia from FIP. And we have two questions for you. How does FIP plan to ensure equity and full participation of pharmacists and pharmaceutical students from around the world in FIP's academic building capacity platforms? I think this follows quite nicely to Dimitrios's last comment in response to his question. So, Patricia?
Thank you, Ralph. Before answering the questions, I would like to take just a few seconds to say something that maybe I should have said it before, but anyway. Academic capacity involves active participation and early interaction between pharmacy students and pharmacists is given by the curricula, which must respond to the specific needs of each country. A curriculum oriented to pharmaceutical services requires a competent and committed academic workforce and appropriately trained pharmacy workforce and resource academic institution. However, there are significant inequities and differences in academic and professional capacity to guarantee students the quality of education they require in order to provide the pharmaceutical services that countries need as professionals. So that leads me to the question, the first question. How does FIP plan to ensure equity and full participation of pharmacists and pharmaceutical students? FIP, in its facilitator role, has developed platforms, initiatives, programs, and resources that are widely available to everyone, or soon will be, as they are always in developing and evolving. So some of the examples I'm going to show you are already said it by Ralph, but I am going to repeat them because they are all linked together, as I said before. For example, competency framework, global competency framework is a document that is available for everyone since many years from now. The academic pharmacy section competency framework is under development right now. On the other hand, we have developed, FIP has developed webinars, just to mention those related to DG1, as many others are interrelated, such as a webinar follow-up from April and May 2022 events, Digital Education in the Age of COVID 1 year later, and more recently, just a few days ago, the webinar entitled Setting Goals for the Decade Ahead. Also, FIP, as you know, they do Congress programming, and the Unit When UNESCO program for academic sharing has been one of the other initiatives that FIP have been involved in to ensure equity and full participation of both pharmacists, young pharmacists, and pharmaceutical students. Just to mention, Unit Win UNESCO, this program involves over 700 institutions in 116 countries, promotes international inter-university cooperation and networking to enhance institutional capacity through knowledge sharing and collaborative work. We have also the Education Transformation Program linked to Unit Win, to the academic section, pharmacy section, to FIP academic institutional membership, and FIP World Development Hub within the FIP Education and Board of Pharmaceutical Sciences, Graduate Sciences Education Initiative, and Board of Pharmaceutical Practice focus as well. There's also this Pharma Bridge program for academics, which has many, many years already and has been very successful. And more recently, the Global Academic Leader Forum Gulf for academic leaders also has developed tools to support nations assess education development needs. This is based on a tool already developed and pilot in Nigeria. To name many other several platforms, initiatives, and resources. As these are available to everyone, it speaks to the opportunity for equity and participation and engagement by all who wish to do so. It is up to FIP then to widely market these resources to make everyone aware of their existence. So all this can be linked to the second question, how does FIP plan to address region country specific needs? Well, let us say that FIP is already doing it. It is developing projects that allow knowing in depth the needs related to education and development of the pharmaceutical workforce. So far, the FIP Global Pharmaceutical Observatory is working on a project to identify and address the pharmaceutical workforce's multinational education and training needs. Also, FIP is carrying out events focused on the different regions worldwide with different needs and priorities. More events, region center, will be done. And regarding the last part of the question, how can IPSF and YPG be involved? My answer is, first of all, participating in all the FIP initiatives. IPSF and YPG can be involved through FIP Executive Committee representatives and participation in the academic pharmacy section and the World Development Hub activities. This is what I wanted to say. Thank you.
Thank you, Patricia. And I'll just add to that YPG and IPSF both have been involved with the academic section and the Workforce Development Hub. They have representatives on the Workforce Development Hub, and it's through those involvements that they can influence the programming and initiatives of FIP, and specifically toward students and young professionals. Okay, we'll move on to, and I want to thank our speakers for their very thoughtful comments regarding goal number 1. So we'll move on to goal number 2, which is early career training strategies. And I'll turn that over to our FIP speaker, Shepard, to introduce himself very briefly and this particular development goal number 2.
Thank you, Prof. Raf. Thank you, IPSF, for giving me this opportunity. So my name is Shepard Mflawa. I'm joining you from Harare, Zimbabwe. I am a global lead for early career training strategy. So as development goal number 2, most of our work is centered on engagement with the pharmaceutical higher foundation training infrastructures in place for early career training, which is for recent graduates, and which we usually call early career pharmacists. for pharmaceutical workforce as a basis for consolidating initial education and training and processing in the novice workforce towards advanced practice. So basically our mandate is to create clear and purposeful education and training pathways or programs to support post-graduation or postgraduate pharmacists in foundation training, be it clinical practice or pharmaceutical sciences. We are also involved in the development of early career maps and frameworks to support the seamless transition into early career practice towards advanced practice. Last year, we managed to release the second version of the global competence framework, which is something that we've been doing, which is a framework that supports early career pharmacists. We're also involved in the development of structured approach for early career pharmacists, monitoring systems to support novice practitioners to engage with peers and preceptors, be it in clinical practice or pharmaceutical sciences area across the pharmaceutical workforce. Well, lastly, we're also involved in using the data and evidence to support investment in early career pharmacies.
Okay. Thank you for that introduction. We'll move on to the questions for FIP-YPG. We have one new representative, and I'll ask him to introduce himself. And then our second speaker we already know is Dimitrios.
Thank you, Professor Ralph. Good evening, good day, everyone. My name is Suleiman Sule. I currently work as the Director of Pharmacy Services for a healthcare startup focused on supporting community pharmacies operating in Nigeria and Kenya. My current work is at the intersection of supply chain and finance, where we sort of use data and tech-driven solutions to solve challenges that are typical of SMEs in these emerging markets. In my previous roles, I have worked in the industry, the specialty care franchise at Novartis and a retail chain pharmacy, and also worked with the government on health insurance schemes. I have been involved with the FIP since 2015, and more recently, I've been working with the FIP-YPG as a professional development coordinator with the project subcommittee. So I'd like to really appreciate the IPSF for organizing this event and the participants so far. Thank you.
Great. Thank you. And thank you for joining us today. And I know you'll be on the docket for questions coming up after this one. So the question for both you and Dimitrios is you have successfully created the FIP-YPG Early Career Development Toolkit, which is quite comprehensive. And the question is, what are your future plans regarding your initiative, sort of in the framework of workshops or additional trainings, virtual, in person, or whatever, to get this sort of the word out about this toolkit for young professionals?
Thank you very much. So since the launch of the toolkit, I think our efforts have been firstly focused on promoting it, getting the word out about the career development toolkit itself, which is a brilliant document, basically putting together case studies, resources, tools, frameworks that could guide early career pharmacists in strengthening themselves in terms of what you want to do next with practice, education, and whatnot. In terms of the work the professional development team has been working on, has been basically around 6 key poles, as we put it. So the first bit had been us coupling, looking at existing activities within the FIP and sort of integrating the career development toolkit into ongoing projects or programs. We've also been working a lot in terms of reaching out to different groups within and outside of the FIP to just sort of continue to advocate, uncover opportunities to train, facilitate, engage with the stakeholders. And we currently have proposals in the work where we are looking to develop trainings and workshops, whether it's virtual, that young pharmacists can attend. And lastly, we would continue to always solicit feedback on the use of the tool so far towards refining subsequent editions that would be rolled out.
Mm-hmm.
So that has sort of been the approach to the toolkit so far.
Good. Demetrios, you have anything to add to that?
Yeah, sure. When we created the early career development toolkit, it was a very rewarding and meaningful project. And it was amazing to come together with pharmacists from all over the world to put this together. And we collaborated, we learned from each other. And I think this translated well in the final work that we produced. As we wrote the toolkit, our initial goal was indeed to cover as much ground as possible in order to produce a result that could impact pharmacists in a wide range of professional capacities and scientific areas of pharmaceutical science. After sharing this document with the FIP community and early career pharmacists worldwide, we now hope to collect insights and feedback for the document in order to better understand the needs of our colleagues in their different functions and countries. Also, since our profession is dynamic and ever-changing, ideally we should be able to constantly update the toolkit in order to match current pharmaceutical needs and requirements. So the understanding of these needs will be a major factor in the follow-up strategy to promote the toolkit in an impactful manner, always in line, of course, with the FIP vision and the development goals. Future initiatives such as workshops and webinars would be a meaningful way to move this project forward. And why not create more specialized or localized toolkits for pharmacists in different regions? Thank you.
Mm-hmm. Very good. Yes, I think this regional approach is one that's very important. And we heard already about some of the work that FIP is doing in that realm. And there's been a renewed effort on doing things on a regional basis in addition to globally as well. So good approach. So questions for our FIP speaker, Shepard. We have two questions. I think they probably should be appearing on your screen now. And I would ask, if you don't mind, to reverse the order of those and speak first to what is FIP recommending to universities and student organizations regarding early career training strategies, and then go to number two, which is how to assess success of those kinds of programs and mentorship programs. So Shepard, the floor is yours.
Thank you, Prof. Ralph. So as FIP, we're actually recommending the uptake of our frameworks, specifically the Global Competence Framework, which we have been working closely with different stakeholders, including FIP-YPG. And also currently we're having a lot of work in terms of, because for some time we've been encouraging people in terms of universities and other organizations in terms of how to use the framework. But what we have also realized is that maybe there is need for also to advocate in terms of the implementation guidelines. So we are actually working on coming up with implementation guidelines for the framework, and also working on a handbook for the Global Competence Framework in terms of having more case studies so that at least wherever we'll be interested in utilizing our framework to actually know how, probably in Kuwait, how they've done it, the kind of problems that they faced during the implementation of the framework, and also what to expect. So basically, we are encouraging people to actually use the framework that we have released, which is the new GPCF version 2, which we released last year during the FIP Visual Conference. And we're also working on the manuscript, which will also give a glimpse of what to expect in terms of guidelines for early career training strategies for young pharmacists. In terms of what indicators should be used to assess the success of the mentorship. So like I said earlier, we as the GD2, we have been working closely with the FIP-YPG. We're also involved in the review of their career development toolkit. And also, we also keep in mind whenever we're working on our frameworks to ensure that it is relevant, and also to make sure that it has to actually be useful in terms of in the area like the mentorship program. And also one of our leads, which is Dr. Dalia, she's actually been appointed the lead for provision and partnership, which they are working with YPG in terms of coming up with a proof of concept on online CPD programs, and also so that all these can also be useful in terms of when with the mentorship programs that was also actually reviewed last year, I think in September. They've also come up with a revised mentorship program, which is now spanning for about 9 months. I think they were also they elected
I think we can move forward to, like, Shepard, can you hear us right now? You are muted.
Yes, I can hear you now.
Yes, we can.
Where did you lose me?
About half a minute ago.
Okay, so I was saying one of my co-workers, Dr. Dalia, who's also part of the GD2, is actually working as a lead for, been appointed a lead for provision and partnerships, working with YPG in coming up with a proof of concept for online CPT programs, which is also something that they've been working on with YPG. And also we as DG2, we've also been involved in the review of the career development toolkit, which was actually released last year in December. So basically, as FIP, we are actually working closely with YPG to provide support and relevant toolkits and information that is useful for their mentorship programs.
Okay, well, hello, everyone. I was able to rejoin the Zoom meeting, so my connectivity is back again. Thank you both for, or all three of you, for your comments on this particular goal. So I think we're going to move on to goal number 8 now, working with others. We unfortunately don't have a speaker from the Workforce Development Hub for this particular goal, but I will introduce it. and then move on to the questions. So I would say that the title of this is quite descriptive, working with others. And I think that it's probably pretty evident to everybody on this call that providing top quality healthcare is, we have a saying, it's a team sport. It requires health professionals with unique areas of expertise working collaboratively to produce the best health outcomes for people individually, but also for populations. And obviously, pharmacy brings medicine expertise to the care of patients more so than any other health profession. So working with others begins with both initial education, both intra and interprofessional education that whenever possible should include experiential learning with other healthcare professional students or even preceptors and mentors. As an example, a physician that would be precepting a pharmacy student in appropriate circumstances. And then that needs to be carried over into health systems, whether, no matter what area you're talking about of practice, that systems that support and promote team-based care among the various licensed health professionals. To achieve true collaborative practice and team-based care requires advocacy and policy change. So example, in my world, allowing a non-pharmacist to precept pharmacy students required legislative change of the Pharmacy Practice Act. And I would imagine similar types of advocacy and policy change efforts would be required in many other countries. Now, there are many other aspects to collaborative working, including pharmaceutical scientists and clinical practitioners working together to solve healthcare needs. But in the end, it really takes individuals who are willing to work together and promote collaborative work. As a professional practitioner or a professional student, you need to be able to demonstrate trustworthiness and competency to gain the trust and respect of other healthcare professionals in order to achieve this goal of collaborative practice, with the ultimate goal and outcome, of course, is improving health outcomes for patients. So that's what this really is about. There are many other aspects. We can't get into all of those at this point, but I will move on now to questions for our speakers from IPSF and YPG, and I'll have them introduce themselves quite quickly. Our YPG speakers we know already. They've already joined us previously, so let's move on to our IPSF speakers. If you would just say hello and introduce yourselves really quickly.
Okay, sure. Thank you, Professor Ralph. Thank you, everyone, for joining us today. So this is Hilal Qadiri. I'm the Regional Project Officer for IPSF AMRO. I'm a fifth-year pharmacy student from Lebanon, and I'm really happy to be joining you guys today. Thank you.
Thank you.
Good afternoon, everyone. My name is Bram Wagner. I'm also a fifth-year pharmacy student from the Netherlands, and I am the chairperson of the European Regional Office for IPSF, and I'm excited to be here to talk about this very important topic.
Great. Thank you both for joining us. And we know our other two, Suleiman and Dimitrios. So the question for all of you, and we'll go in the very order that we have you listed here, is what are the benefits of intra and interprofessional collaborations that you may have experienced or observed? So Hilal, we'll start with you.
Okay, thank you again, Professor. So let me start by my life motto that I always have it in my mind during my professional work. Alone, we can do so little. Together, we can do so much, which is said by Helen Keller. According to the WHO World Health Organization, By implementing inter and intra-professional collaboration and learning to work together and respecting one another's perspectives in healthcare, multiple disciplines can work more effectively as a team to help improve patient outcome, which is our main goal. From my little experience as public health chairperson and regional project officer, I have really seen the importance of this type of collaboration. One, it helped us to reach a maximum number of participants in which it allowed participants to exchange valuable information that helps both sides improve their knowledge bases. Two, because it allowed people and groups to work together to achieve a common goal or drive mutual benefits in short period of time. Three, interprofessional collaboration had helped to respect different healthcare professional team to respect each other. Finally, teamwork is the ability to work together toward a common vision. Remember, teamwork begins by building trust, and the only way to do that is to overcome our need for invulnerability. Thank you. Professor Ralph, I think you are muted. We can see you talking, but you are
Here
muted.
we are. Okay, sorry about that. Bram, it's all yours. And
Yes, thank you very much.
You unmuted. That's great.
Okay, thank you so much. If you allow me, I would like just to start by saying that in the IPSF European Regional Office, we have actually made interprofessional education and collaboration our main focus this mandate. And we did so by connecting this team to most of the activities that we organized. And we also held a policy session with our member organizations on this topic, which was titled Interprofessional Collaboration in Pharmacy Education Towards Better Health Outcomes. And looking at the question, I just wanted to bring that up because I think one of the main benefits that we have is actually related to better health outcomes. And currently we are in the process of creating our regional resolution on this topic, and we will continue to advocate for this in the future. So if you will allow me, I will mainly focus on interprofessional collaboration and talking a little bit from my own personal experience, but also relating that to what we have discussed in our region with our member organizations. And I think when we are talking about collaborations between doctors and pharmacists, one of the main benefits that we have is taking some of the burden off of doctors when it comes to improving treatment adherence, optimizing pharmacotherapy. And these are tasks that as pharmacists, we are very well equipped to take on. And when the collaboration between the pharmacist and the GP is good, this also often leads to improved outcomes for the patients. And I've seen this most profoundly when doing medication reviews with patients, which is quite common in some European countries, but not yet in all of them. And these medication reviews can lead to many benefits, ranging from small quality of life changes to actual improved health outcomes. And in my experience, when a patient meets the criteria to undergo such a review, it's very rare that no changes in the pharmacotherapy are made after. Which really shows their added value. And if the collaboration is good, the doctors are also quite happy with the results, as well as the decreased workload for them. So having successful collaborations on medication reviews can also lead to better collaboration in general, because as GPs become more aware of the pharmacist's expertise, they also start appreciating the pharmacist more and also proactively approach the pharmacist when looking for advice. And the Euro member organizations also noted that improving interprofessional collaboration also greatly contributes to awareness of the pharmacy profession. So all in all, I think this form of interprofessional collaboration only has winners, provided that the pharmacist is compensated sufficiently. And some of the challenges I see, I would say, are sharing patient information and lab values, as well as the financial compensation, and ensuring that as pharmacists, we should not overstep doctors in their work. And it's very important to make very clear agreements with GPs in this regard. And I would also briefly like to touch upon interprofessional education. As our member organization in the European region have very clearly stated that there is a big need for it. and experiential learning with other healthcare students is the basis on which we build the collaboration later in our careers, and it greatly contributes to the understanding of the healthcare professionals' expertise. And unfortunately, while a number of countries in the European region already implemented this, this is not the case in most countries. And personally, I'm from the Netherlands, and we have it as a requirement in our curricula. And I can really say that maybe if it wasn't even that useful for me, it definitely was useful for the medical students. And I had a lot of positive experiences with it. And I really wish that all pharmacy students could undergo such a course, which is jointly organized with medical students to learn from each other. And I think that's all I have to say for now. So I'll pass it on back to Rolf.
Thank you, Bram. That was really good. And I think you probably helped me answer the questions that I have for myself later on as the FIP representative. A lot of good information there. Thank you so much. We can move on to our YPG speakers. Suleiman and Dimitrios, would you like to add to these comments so far?
Thank you very much. I think from my experience, there's a different lens I would like to bring to this. So not necessarily within the healthcare setting, in collaboration within the healthcare setting. So as you're all aware, I currently work in Nigeria and parts of Kenya. And what we are increasingly seeing is that in terms of the back office type of stuff, the organization, the transforming how pharmacies practice, the supply chain and the rest that is underpinning it. There's a lot of work, cross-functional work being done by, say, people outside of pharmacy trying to bring digitization to all of these. And that's one area I have seen pharmacy practice benefit from, where we have people coming in to bring efficiencies into the models in which community pharmacy operates in this setting. I think that's one area where, like we've talked, whether it's the education, seeing how we could introduce some aspects of these into the curriculum. We've seen some of the work FIP is doing, trying to talk about digital health and see how to collaborate with people in this space. That for me is one aspect that I think it would be interesting to see how it develops over time and how YPs can also contribute to improving this in their settings. Thank you.
A very good perspective. I thought that's really wonderful for us to be thinking about that. Thank you very much. Dimitrios?
Thank you, Ralph. I would like to start first with the intra-professional collaboration, as it's the one that I invested most in my first career steps. So getting to know different projects and individuals within my close group has been a great way to gain a better understanding of the different aspects of the work, and also to enrich my own work with new ideas that I would not have thought of myself. It's also a practical way to have a look in potential future stages and prospects for me in my current role. For me, it's also a way to appreciate the work that every single person puts in for its achievement, for the achievement of its goal, whether this a successful grant or an impactful publication. Also shadowing co-workers and asking them questions about their daily routine and their tasks is very helpful to build a broad and clear perception of our field and figure out where we see ourselves and how can we best contribute to it. On the other hand, interprofessional collaboration can be eye-opening for the way that we perceive our profession as a whole, I think. As someone who is active in academia, familiarizing myself with the role of the pharmacist in community pharmacy or the pharma industry is a way to put the pieces together in the role that we have as researchers and ultimately as healthcare providers. The work that we do in the laboratory or in a research group is a key player for the advancement of science in the service of the patients so that we can produce diverse, accessible, and high quality therapies for patients. And of course, this is not easily evident in our day-to-day work. So this is why interprofessional collaboration is necessary, because the broader the perspective we have, the greater the impact could be. Thank you.
Okay. Well, I thought those are great insights by all four of our speakers into the benefits of intra and interprofessional collaboration. I think it is equally important that within pharmacy, so the intraprofessional part of it, that we all work together no matter what area of pharmacy we are in. From the areas that Suleiman talked about all the way up, whether it's community pharmacy or clinical pharmacy in a hospital setting or what have you, is all working together toward the same goal of improving health outcomes for patients and care of patients. So how can FIP enhance both intra and interprofessional collaboration in the pharmacy workforce? Well, again, I think we've talked about a number of these things already in regards to other aspects of initial education and early career development. But frameworks, competency statements, and guidance on best practices from around the world that we can share through FIP networks, webinars, workshops, both virtual and hopefully someday soon in person, to share best practices and successes. So I think this was brought up by Bram, is the idea of working through and with professional societies, not just those in pharmacy, but those related to medicine or nursing or other health professions, to forge these collaborative agreements. And of course, with regulators to change the pharmacy scope of practice if that is needed also in your particular country. So it really requires, again, pharmacy practitioners from all the different sectors of pharmacy working together to speak with one voice and move ahead on interprofessional education and practice in whatever that setting is. And sharing what are now formalized interprofessional education programs and disseminating that widely to demonstrate that there are multiple ways of engaging in interprofessional education and training postgraduate level. All of these can be accomplished across the networks that FIP has formed both globally and regionally, and the platforms that they have, many of which we've talked about. One of those is the Pharma Bridge program, where we have exchange and learn from each other as well on how to promote and do this work. Advocacy is clearly an important part of moving from independent to interdependent team-based care. And that is just a long process. It doesn't happen overnight. And again, as discussed, it's building that trusting relationship and respect for each other that will make it work well. I want to go back to Suleiman's perspective here. The other thing that FIP started in 2020 is a technology forum. And of course, we'll get to Development Goal 20 on digital health. And it is this role of technology outside, not just the pharmacy, but outside of healthcare as a whole, and the influence that the advanced technologies have on all aspects of healthcare, pharmacy included. And so FIP has this relatively new technology forum that is helping to guide FIP in those areas, as well as this focus on digital health that we'll get to in our last development goal. Now, what advice would FIP give to the new generation? I think I can speak for FIP, but I know I'm speaking for myself and out of the experiences that we've had in developing interprofessional education programs, as well as collaborative agreements across various health professions, again, with the whole idea of improving health outcomes. Persistence, commitment, patience, advocacy, and being goal and outcomes oriented are all the attributes and qualities that you'll need to move into a true collaborative agreements and team-based care. And this is true if we're talking about the role of technology or just working with other health professionals to improve patient care. This is sort of a continuous process. And again, it doesn't happen overnight. Don't be discouraged, just keep working at it because it will work and it'll get much better. There's also, I think, the personal willingness to do more than your business as usual workday, but having that vision and determination and initiative and working with your colleagues to achieve this goal of collaborative team-based care is really what it takes to get it done. And that's on the part of pharmacists, but on our counterpart health professionals too. Which brings me to the last one, which is champions. You need champions of inter and intraprofessional collaboration. You will find those champions, people who are thinking like you are. You know, when you start with a few and then you gain more and more disciples as you go along. And over time, it can become part of the system that you're working in as well. So this is something that, again, takes a considerable amount of effort, but it really all begins, and this was said early on, I think Hilal said it, you have to build trust and respect among all the partners in this collaborative effort. You learn from each other, you learn what the capabilities of each person is that is on that team, and respect what they do and trust what they do. And that's a huge responsibility when the fate of a patient is now turned over to you, and the rest of the team is expecting you to be at the top of your game in taking care of that patient. So while it's a great thing to want to be a part of, and we need to be a part of, it's also a tremendous responsibility that we have also. So I think there are many areas within FIP that's helped supporting this in various ways. And we've talked about these several times now. And in our own individual efforts in the work that we do every day to convince people that collaborative work with pharmacists is actually what is needed to improve patient outcomes. The other part of all of this is collecting the data and demonstrating how well outcomes improve when pharmacists get involved in direct patient care. There's studies on this. They've been published over the years. And many times you have to do it on the ground with the very people that you're working with. So lots of different moving parts to this, but the only thing I can say is keep at it, and it will happen, it will work, and it will be a great feeling when it does. Where I live in the United States, much of healthcare practice, I shouldn't say much, but all of healthcare practices are regulated at a state level. So you have to do it state by state. And we have collaborative agreements with the boards of medicine and nursing that allow pharmacists to take on new patient care responsibilities. And we've had a pretty good relationship with them. I couldn't say that that would have happened 15 or 20 years ago, but it's happening now. And each time we make progress and build that trust and confidence, it leads to the next one. So you just keep at it, and it's going to work. So that's the advice that I would give to our younger generations is be committed, be persistent, and build that trust, and things will actually turn in your favor. So it's and the patient's favor too. So we'll leave that and we'll move on to goal 6, which is leadership development. And I'll ask our FIP speaker, Minesh, to introduce yourself and introduce us quickly to leadership development. I think we have just one more to go after this, if I'm correct. So we'll try to work our way through these maybe in the next 15 to 20 minutes at the most, and then I'll leave some time for questions at the end. Minesh.
Thank you, Ralph. So my name is Minesh Parbat. I'm here from the UK, and I'm going to be I'm representing FIP Development Goal 6 on leadership development. One of the key things that I've been hearing, and this is my personal opinion, is leadership is the golden thread that runs through all these development goals. And it's critically important to ensure that we acknowledge that. Without this effective leadership, it's going to be a big challenge to be able to implement these. So leadership is that golden thread that runs throughout all these development goals, and effective leadership. So with regards to my background, I'm a chief pharmacist here in the UK, and I work in primary healthcare with physicians. I've had a number of roles within the community pharmacy setting, as well as the pharmaceutical industry. And I have the privilege of working with some other colleagues, Professor and Dean Toyin Tafade at Howard University College, and a clinical assistant professor, Dr. Miranda Law, who's also a part of this WDG6 group. And we work together to demonstrate and deliver on this leadership development goals. So overall, the strategy and the program that's in place is around professional leadership skills. This starts from undergraduate level all the way to once you qualify and are actually practicing as a clinician or a pharmaceutical scientist. And this is about lifelong learning. Learning just does not stop. Continue to develop, continue to develop on your leadership skills at all stages of your career. And creation of programs and strategies to implement effective leadership are fundamentally important, be you a pharmacist or a pharmaceutical scientist. And to create an advocacy of leadership development in all healthcare teams. So we spoke about interprofessional and intra-professional development. So this is where leadership really comes to its fore, and ensuring that whatever leadership is developed or how we implement our leadership, there is a competency framework and a foundation in place to ensure that we can do this effectively. And this very much happens in an early years framework as we develop and move throughout our career. Next slide, please. So as I aforementioned, I'm fortunate to work with some really innovative leaders within our profession globally. And as a group, we have been fortunate to implement some plans. And in that, we last year did a webinar on responding to the pandemic together. And this was around gender equity and looking at the narrative behind that. Looking at how we could actually balance the scales. How examples of how female leaders, female pharmacists have actually really been instrumental in supporting patients and leading from a pharmacy perspective, and then how men have also equally been critical in delivering exceptional patient care also. We've also done a publication on implementing online longitudinal leadership development. And this is a CPD tool, which we published as a team. And now we're looking at Leadership Development Program 2.0, working in collaboration with the YPG, and looking at a year-long longitudinal leadership training series. And we ran a pilot in 2019 and 20, and we're currently looking to establish a formal base of this program and how we could continue to implement based on this successful pilot. And lastly, I'd like to mention is on our very important global outreach piece of work on our global leadership needs assessment for pharmacists. And there has been some really interesting things that have come back as a consequence of this piece of work, where pharmacists really want to kind of focus on communication and emotional intelligence, team building, looking at vision development and conflict management. Those were the top 5 learning needs from the global leadership assessment that have already come back. And, you know, pharmacists really want to, and I'm sure pharmaceutical scientists also want to focus on conflict management, change management, negotiating skills, strategy, how to develop a strategy, and time management. So all these competencies are vitally important to ensure that we continue to develop as leaders. And having you on this call today, I can honestly say that each one of you are leaders within your own right. Thank you.
Great, thank you for that introduction. Very, very relevant points. I think that as needs assessment is eye-opening, don't you think?
Certainly is, absolutely.
Maybe not expected, but good to see. Okay, we'll move on to our questions for IPSF. We have 2 new representatives, and we'll have them introduce themselves in YPG, where Suleiman is back again with us. So our IPSF speakers, could you introduce yourselves?
Hello, everyone. Good afternoon or good evening, depending on your time zone. I am Noah Sise, and I am a recent pharmacy graduate from the University of Sierra Leone, and I'm from Sierra Leone, of course. I am currently the IPSF Afro Regional Project Officer, wherein we organize events on public health, pharmacy education, and professional development. So I'm so excited to be here, and thank you so much for the opportunity.
Thank you for joining us. Maria?
Thank you, Professor Ralph. Hello, everyone. It is such an honor to be sharing this space with people from all over the world. My name is Maria Fernanda Sanchez, and I am a pharmacy student from the University of Costa Rica. And currently, I am the sub-coordinator of public health at the Pan American Region Office of IPSF. I really appreciate the invitation and congratulate the organizer for planning this event. Hope you all enjoy it and learn a lot. Thank you.
Thank you, and thanks for joining us. Suleiman, we know already. So let's go into our question for our IPSF and YPG speakers. Why should pharmacists and pharmaceutical science students acquire professional leadership skills in a whole range of areas? And we just heard some new ones. That includes clinical, scientific, executive leadership, and more.
Thank you, Professor, for the question. I'll start by making this statement. Great leaders don't set out to be a leader. They set out to make a difference. It's never about the role, always about the goal. Leadership is something in which is very, very key towards building up our professional life. As being a leader, you learn the act of building relationship within teams, to know, define responsibilities and achieving tasks, to help to develop and display effective communication and interpersonal skills. This is very, very key. Communication skills is everything. How you communicate to your patients goes a very long way, because it builds the confidence of your patients, and it also helps you in your whatever drug or therapeutic interaction as the case may be. It helps build confidence. Of course, greatly, leadership builds confidence. You have the opportunity to attend events, you have the opportunity to speak in events, and the more you do it, the more confidence you build, and which goes a very long way in basically in developing your professional skills. You have to have skills beyond just pharmaceutical or scientific skills. You have to develop a brilliant personality as a professional. Also, leadership improves your networking and builds on your personality, as I made mention. It's very, very key. Today, we have an opportunity to interact or be in a forum with Professor Altia here, and so many other great people from FIP. These are things you cannot just get when you're just sitting like just a normal student. You have to aspire to be something and create a difference. And being so, that builds you as an individual or as a professional. Leadership teaches skills which may not be acquired in classroom. Of course, there are so many skills that you develop that you cannot acquire in a classroom. Like, for example, some of the soft skills, emailing etiquette, like giving, most of the things you cannot acquire in a classroom. It's very obvious. What you learn in classroom, it's basically pharmaceutical and scientific and your clinical skills, of course, which is very, very important. But your personality is what carries you as an individual. It's what carries you as a professional, which is really, really, really key. Because before ever someone interacts with you or to know how knowledgeable you are as a professional, they have to first assess your personality, which is really key. And most importantly, leadership improves your problem solving and intervention with patients and provide a special skill with patient counseling. Very, very key, because all this evolves around your personality as an individual. Having a brilliant personality helps you to how you interact with your patients and how you carry yourself as an individual, which is really, really key for young pharmacists and for students to aspire to take up leadership roles. And lastly, of course, I think Dr. Manish made a very, very brilliant opening statement saying that leadership is the golden thread that runs through all the goals, which is very, very key to note. Every single goal that you see without an effective leadership cannot be implemented, or the set task or goal cannot be reached. So we should always aspire to become good leaders, because being good leaders, you become a very good professional. Thank you so much.
Thank you, Noah, for those insights, really important points. So let's move on to Maria.
Thank you, Professor Ralph, for the question, and Noah for your statement. Well, let's start a little bit more profound about what leadership is. Leadership is the process of influencing others to achieve goals, right? It is about uniting and inspiring work teams. So a leader coordinates and removes the obstacles so that each member of his team does a good job. A leader listens and understands needs. That's why today having leadership skills is essential for pharmacists to perform as leader in the healthcare system, the pharmaceutical industry, or even their community pharmacies or offices. Today's pharmacists need the ability to lead teams to gain organizational efficacy. Leadership allows turning a threatening situation into opportunities. What better example how many pharmaceutical professionals adapt to the condition of the pandemic to continue meeting their objectives through different activities. They continue providing consultation through digital media, they communicated through social media campaigns, they guide their teams through video conferences, and educate to the screen of their devices. It is no longer enough to have technical and scientific knowledge, but we have to know how to act, how to communicate, and how to guide our teams to achieve and maintain the health of our patients. That is actually the goal of our profession. Through leadership, we can transform the drugs and medications into hope and quality of life. We can turn knowledge into science and actions into impact. Leadership ability is innate to some people, but it is also a quality developed and continuously worked on for others. And that is why we must train ourselves and form our skills from the moment we are students right now, so that tomorrow we will be better professionals and capable of transforming our environment to our fairer and healthy ones. Thank you.
Ralph, you're muted.
Suleiman, yep, I got it. Suleiman, added comments, please.
Yeah, I think for me, I think responding directly to the question why, like the rest of our colleagues here have stated so far, personal leadership seems it is one of the key recipes for effectiveness. If you are an effective individual, it translates to how you go around your work, your tasks, whatever that team you play in. However, there are two pieces of information here I'd like to share, and I hope this is something we hope to go home with. The first bit is the WHO concept of what this a 7-star pharmacist is. We see our roles being dynamic now, a pharmacist, also a manager, a teacher, a communicator, a caregiver, a lifelong learner, a decision maker. So while we focus a lot of our attention on building the technical skills, these soft skills are important prerequisites to developing our experience, workplace and cultural fits that eventually would make us successful leaders. The second point I just want to say is in line with the publication by the World Economic Forum, I think in 2020, talking about the changes in skills being needed. Well, gladly, in terms of the emerging roles, there wasn't a lot of disruption to the pharmacy, and our relevance in global health and healthcare still remains. However, it's important to begin to see the emphasis on skills like critical thinking and analysis, problem solving, self-management. We got to see a lot of how a lot of resilience, flexibility in responding to stress. I think the whole world was in a state of stress that required some form of leadership to help us come through it. So you could see stuff like with the pandemic, application of technology, evolving workforce demands. There's that constant need of advocacy and leadership that would need to come to the fore for us to continue to be impactful. Again, I just want to sign off by really thanking the IPSF for organizing this, because this to me is leadership in action. By virtue of this, we get to, we've talked a lot about mentorship, we've talked a lot about networking. These also all open doors for learning opportunities and basically shaping the next generation of leaders in pharmacy and pharmaceutical science. So that for me is the importance of making sure students get to acquire these skills. And yeah, the sky is definitely the limit. These skills being sharpened. Thank you.
Thank you very much. I'll just make 2 comments before I turn it over to Manish. One is, I think what is evident through all of these comments is that leadership occurs at all levels. It's not just by those who have titles. You need to take leadership in whatever area you're working in. And again, the whole purpose is to make things better, right? So, so I think that's one. And the other is all the comments that we've heard from our IPSF and YPG speakers today is why I just love working with you people, because you've got great ideas, you've got inspiration, you've got aspirations. And it's just really good to hear what you're thinking and what you're feeling and what you want to see going forward. So I just want to thank all of you collectively for the great input you've had. So let me turn this over to Manish now. And the 2 questions we have for him is, what is leadership development about, and how can IPSF and FIP-YPG get involved in that? And how do we ensure leadership development, again, from the FIP perspective?
Thank you very much. Well, Maria, Noah, and Suleiman, you've certainly stolen my thunder as a consequence of what you've delivered. So fantastic, well done, excellent. Great to hear everything about leadership. You know, you can tell I'm passionate about that. So well done, each one of you. So to address the question directly around what leadership development is about and how youth can be involved to achieve this goal, there's 4 things I'd like you to think about here. Is what you actually believe as what a good leader is. I think, you know, we really need to kind of, you know, as Ralph mentioned, this is not about title. This is not about, you know, having as many qualifications as you possibly can. This is about how you can actually directly impact patient care, 1. 2, how you can actually actively demonstrate and are able to develop yourself as a human, you know, and that is vitally important. And in doing so, you know, and this goes on to the second point, is having the desire to grow, seeking opportunities, able to seek out through your networks, grow your networks, seek out opportunities to grow as individuals, grow as a professional, grow as a person. And then establishing what the barriers are to developing yourself as a good leader. You know, are there any specific hurdles in place that are actually preventing you to actually developing? And one of the last thing I'd like to, and this is the fourth point, and this is fundamentally important, I think. And, you know, I've been very fortunate to have some really inspiring leaders that I've been able to work with, is having an effective mentor, having a coach and a mentor to be able to take you on this journey. And remember, a mentor is not just there to actually almost counsel you on your, you know, I've had a good day today, I've had a bad day today, but it's actually holding your hand to actually take you through that journey. And there will be a point where they will need to let go of your hand and let you fly and just literally go for it. So having a mentor is very, very fundamentally important. So just to go through those four again, what your perceived ideas are of what good leadership is about. Separate it, management from leadership. Literally detach that. What is an effective leader? What are your desired growth opportunities? Where are you going to seek those opportunities? By networking, by getting to know people, by just even being on this call today, this webinar today, you've set yourself up on that journey already. What are the barriers to developing into a good leader? And one of those journeys, one of those ways you can actually break down some of those barriers is by having an effective mentor. Really, really important, really important. So how do we ensure that leadership continues to develop? Well, that's one very personal to us as how we develop as a human. How do we develop as a professional? How do we put our patients at the forefront of everything that we do? And then from a FIP perspective, this global leadership needs assessment for pharmacy is going to be a fundamental document once published to really kind of reach out globally around what do pharmacists want? How can we take the learning from this needs assessment and almost instill it in our undergraduates, you know, our pharmacy students, to be able to grow and nurture themselves into some really effective leaders for the future. I'm going to stop there and hand back over to Ralph.
Thank you so much for those comments. All really good. Okay, we're going to move on to our last goal, and that is digital health. This is one of the relatively new development goals that have been added over the past year or so to the original 13. And I will turn this over to Professor Lillian Azzopardi. She can introduce herself, this digital goal, and then answer the question.
Oh, thank you, Ralph. And I would like to thank the organizers for the invitation to join you and contribute to the reflections from FIP with regards to this very new and exciting area of digital health. The focus in this goal is both the workforce that we need to empower pharmacists and the future pharmacists. So it gives me great pleasure to see many of you here today to be able to accept the change that digital transformation is providing in healthcare, specifically in pharmacy services, and to be able as change agents to maximize on what digital health provides to us so that we can provide better services to our patients. Now, the involvement I have already had in this startup with this digital health goal is that I was one of the core team members within FIP to develop the report that was launched last January with regards to digital health in pharmacy education. And during that report, we had a very good, robust and active contribution from IPSF. In fact, Karima was one of my co-colleagues in this adventure, where it was a baseline and the first to understand where we stand with regards to digital health in education? What are the expectations of students with regards to digital health in education? And what are the views and visions of the practitioners? So that is one of the strengths in this goal, that it's relying both on the workforce, education, and you will see also, as listed in detail on the slide, that in actual fact, this goal interlinks with all the other earlier goals that we have just been mentioning. So it's that makes the digital health innovative and exciting, in that through digital health, we are supporting academic capacity and training capacity. We are supporting and maximizing on how we collaborate with other healthcare professionals. So how we can sustain the interprofessional perspective that we have already discussed earlier. And also the leadership that needs now to be taken up by all of us to start making the change and get this change across our different practices in our different countries. So this is, in short and in very brief, the focus of digital health to maximize on the digitalization that will enable us to reach out to patients, provide access to patients to pharmacy. And I would like to add that we need to empower ourselves and to become change makers so that we maximize on digital health, so that we focus on patient-centric digital pharmacy services. I think that provides a very brief concept of this idea. There are many organs within FIP which are aligning into this goal. There is the FIP Technology Forum. There are sections, working groups within the FIP academic section, of which I'm also a member, where we are working on how to get digital health more moving in the education scenario. And we look forward, of course, to have the view of the students, of the young practitioners, as they are also key players in this change making to make the digital transformation happen in pharmacy.
Yep.
Thank you, Ralph.
Well, thank you, Lillian. Don't go anywhere because we have a question for you. So how does FIP plan to facilitate the inclusion of digital training and digital technology into university curricula around the world? And you can expand on that and go beyond that if you'd like.
So one of the activities that is gaining a lot of momentum and which is happening very shortly within the next months is that the idea started off by a working group in the FIP academic section, has been taken on board by FIP as what is being referred as a one FIP exercise, meaning that it goes beyond the academics. It's incorporating the people and the technology, the students, the Board of Pharmaceutical Practice and the Board of Pharmaceutical Sciences, so that together we can launch a masterclass on digital health for academics. The idea is to have different modules to start off the talking, the discussion, the sharing of experiences of how we can offer digital health in the curricula, and then to also move on to providing a standard format of elaboration. So it's also in a way contributing to the continuing professional development for academics to be able to empower pharmacists and students to take this digital health education. So that is one way because in the FIP digital health report that was launched last January, one of the findings that was brought forward was that a number of academics and schools of pharmacy, one of the challenges is that they feel that they need a more constructive way of how to involve digital training in the pharmacy curricula. So this masterclass, which will be launched by this year, intends to support this empowerment from an academic perspective. There are other initiatives from FIP, which are where one is also looking for a longer term vision to provide a global framework, a global toolkit that could be used by schools of pharmacy to adopt and adapt in their own settings, which will facilitate how we can then draw on examples in this toolkit and provide the experiences to the students. So those are two examples that are currently on plan from FIP, together then of course with linking with a roadmap and the supporting policy to support and empower and have the schools of pharmacy feel the movement, the momentum to increase the incorporation of digital health in the curricula. One point maybe I want to make here is that the incorporation of digital health in curricula may come in many different formats. It may take the form of special courses, dedicated courses. It could be integrated. There's a lot of opportunities at the experiential sites in rotations for students. So there are many formats that this digital health could be included in the curricula. And what FIP vision is to expose these different possibilities and provide toolkits for schools of pharmacy to reflect on the best model that is available for and useful for their setting and start the momentum going. Having students here, I do think that you will be the change makers. You also are powerful in driving schools of pharmacy to make changes necessary. So YPG, IPSF are important partners in making this digital transformation in the pharmacy curricula around the globe.
Thank you very much, Lillian, for those information pieces about what's going on at FIP. And this is a major thrust of FIP right now, and obviously will be for quite some time, because this is our future for all of us, whether we like it or not. It's here and it's more to come. And so, yeah, really important development, I think. And I'll just echo Lillian's comments that the students and the young pharmacists on this call will be the drivers. They're in the driver's seat. Yeah. So that's great. All right. So we're moving on to the question and answer period. I would just like to thank all of our speakers for the great information and insights and advice that they've given all of us for each of these development goals. And we'll just move on. But first of all, I just want to make sure you see my background. That's actually where I live, right on the foothills of the Rocky Mountains in Colorado. And it actually looks just like that today. We have snow on the high mountains and everything else is green. And in 1 month, it'll dry out and turn brown. So it's nice to see right now. But so I'll move it over to our organizers for any the questions and answers.
So far, it looks like there's no questions, but I would like to say, if you have any question, you can just open your mic, or you can write to the chat box. We will wait for 1 minute, and if not, we will continue. Thank you.
No questions. We've answered everybody. So here we are. No.
Okay. So I would like to say that thank you all. I would like to thank all the speakers and representatives for their great contributions. It was a pleasure to have you in our session. And thanks our moderator for his efforts during the session, and to all pharmacy education team members for being amazing teammates while organizing this event. I also would like to thank our participants for their interest in the session. I hope it was enjoyable and also informative. You can follow IPSF social media accounts to be informed for our upcoming events. We came to the end of this session, so I hope it was like you expected. Thank you for your participation. We look forward to see you in our other events. Thank you all again. Have a good day, good afternoon, good evening, depending where you are joining us. And you can say bye in your native languages.
Muchas gracias. Muchas gracias a todos.
مع السلامة.
Bye-bye. Thank you.
Gracias, hasta pronto.
Everyone.
Salin
Thank
Nigate.
you.
Güle güle Emine.
Ευχαριστούμε πολύ. Γεια σας.
Güle güle.
Well, goodbye all.
Goodbye, everyone, and thank
Enjoy
you
the
so
rest of the
much.
weekend.